So good afternoon, ladies and gentlemen, and welcome to this event on the commercial determinants of health. Let me start by thanking the Global Health Center and the Graduate Institute for organizing this very exciting and important event and selecting such a critical subject for our discussion, but particularly to you, Ilana, for giving us this opportunity. And also to focus on the global struggle against non-communicable diseases, because this is one of the areas that, or the subject of our discussion today is going to be one of the critical areas where we need some more discussion, particularly if we really want to scale up the work to make a difference in non-communicable disease prevention. Let me make maybe just 2 points at the beginning of this event. And these 2 points is to explain why I think this discussion is very important, especially at this time. One is the fact that in 2011 we had a breakthrough. We had a political declaration which was passed by heads of states and government at the General Assembly at the United Nations in New York. And this political declaration provides the vision. It also sets a comprehensive roadmap to tackle one of the greatest challenges for development, and not just for health in the 21st century, as the political declaration mentions. And this declaration actually recognizes that effective NCD prevention requires leadership. It requires multi-sectoral approaches from the different sectors of government, which includes, of course, trade, industry, and finance. And it also requires very strong partnerships with the private sector, apart, of course, from the fundamental conflict of interest in relation to the tobacco industry. So it goes without saying that the focus of collaboration with the various government departments, particularly the ones I mentioned, and the corporate sector is on trade and industry related to food and food products, addressing the harmful use of alcohol, and also the affordable access of medicines and diagnostics. The same declaration actually calls for real efforts to support the manufacture and production of healthy foods, taking measures to implement the recommendations on marketing for children, and strengthening the implementation of the International Code for breast milk substitutes. And the declaration also stresses the critical importance of promoting access to essential and life-saving medicines and technologies. And it also calls specifically on countries to make full use of the trade-related aspects of intellectual property rights or the TRIPS flexibilities. And there is absolutely no doubt that globalization and the trends related to globalizations are contributing to the commercial determinants of health, and in many cases actually leading to higher levels of risk factors. And that is why it's important that we analyze carefully how this is operating and how it should be tackled. So in summary, this event in 2011 highlighted the priority and importance of addressing this issue. The second point, which is related to the first point, is that the United Nations General Assembly organized a second high-level meeting in July 2014. The whole objective of that meeting was to assess the progress that countries were making in implementing the recommendations and the roadmap included in the 2011 political declaration. Now, the main conclusion that was made during the July 2014 UN meeting is that the progress made over the 3 years period, 2011 to 2014, was, and I'm now quoting exactly the conclusions and the report, the progress made was inadequate and highly uneven. And these were exactly the words that the document used. And so member states decided to have another meeting. And this meeting is going to take place in 2018, again in the presence of heads of states and government, at the beginning of the General Assembly session in September 2011. And there will be a discussion, and prior to this, of course, there will be discussion with member states on the progress that countries are making. So it is very important at this stage, and preparing for the high-level meeting, that we know exactly the kind of constraints that impede implementation of the roadmap, the UN roadmap, and that impede progress towards NCD prevention control. We are, of course, having a number of process indicators to assess the progress countries are making, and we know that what was said in 2014 still applies. So the progress is still inadequate. So that is why it's very important that we try to examine these constraints. And one of the major constraints is our subject today, that we are not doing very well in relation to addressing the commercial determinants of health. And that is at least what many people believe. I mean, some people here might disagree with this, and we will have a very healthy debate on this subject today. But it is one of the constraints that need to be discussed, analyzed, and solutions identified. How do we scale up in this area of work? One more point before we actually start is that it's important to mention that we are addressing the whole spectrum of NCDs. So the UN political declaration focuses on the 4 groups of NCDs, which are the cardiovascular disease, diabetes, cancers, and chronic lung disease. The discussion on the commercial determinants of health is broader. And so it will include equally important issues like mental health. So I welcome also expanding the discussion to include all the non-communicable diseases in this. So we have a very prominent international expert with us today, special interest, and really great contribution on this subject. It's my great pleasure to welcome Ilona. Ilona should be also, of course, welcoming us because she's the director of the Global Health Cluster. But the commercial determinants of health is one of her interests, and we will hear from her an introductory presentation that focuses on what we actually mean by this, but at the same time, hopefully, how do we move forward? So, Ilona, the floor is yours.
Thank you.
Thank you.
Thank you. Ala has not quite got used to the fact that he's senior fellow here, and this is his center as well. So you were actually thanking yourself for being here, Ala, and that's also something special. Before I go into the commercial determinants of health, I wanted to raise something else, and that is a couple of years ago, some of you might remember, we published a paper called the Committee C. And we had suggested at the World Health Assembly, next to Committee A, which deals with program matters, and Committee B, which deals with budgetary and managerial issues, that there be a Committee C. And that the Committee C increasingly invites other stakeholders to provide the space within the World Health Assembly without taking decisions, to provide the space within the World Health Assembly for discussion between member states, civil society, academia, philanthropy, and the private sector on critical issues. And the hope was that maybe some of those discussions might actually also help overcome some of the very strong problems and fears that, as we meet here, are being heavily discussed up over there in relation to childhood obesity, for example. So one of the reasons we started this series of events here at the Graduate Institute was to basically say, if we can't get the Committee C there, we'll do the Committee C here. And so that's a little bit of what we're doing here right now. And that also explains the composition of our panel. And we hope very much that you will enjoy that discussion. The commercial determinants of health is, of course, a construct. It's an intellectual construct that we came up with because we had another successful intellectual construct that really drove forward the global health debate, and that was the construct of the social determinants. Now, I'm a social scientist, and I can tell you everything that's wrong with that word and that construct, using the word determinant and what does social really mean, and all those things. But it captured people's imagination, and it drove the agenda. And therefore, when a colleague published a couple of years ago a very interesting article on what he called the commercial determinants of health, I think it was in the BMJ, we felt we should take that discussion forward. And from that, talking about the social determinants of health, we've of course also talked about the environmental determinants of health. Many people talk about the behavioral determinants of health. We felt there's particularly two of these groups, categories of determinants that we need to look at more closely, and they're heavily interlinked. One is the commercial determinants, and the other is the political determinants of health. And so we're hoping, and actually one of my dreams would be that just as we had a Director General that created a commission on the social determinants of health, that we might have a Director General that creates a commission on the commercial determinants of health, and that would take our discussion forward. The context is twofold, again, if we stay on the level of concepts. On the one hand, that we live in a global risk society. But if you talk to people about risks today, and I've been very involved in that discussion, it's all about infectious disease risks. It's about bugs and parasites and viruses and bacteria and whatnot that know no borders, and all those statements. And what is actually not taken into account, that all the conditions we link to what we have again grouped in a construct, non-communicable diseases, are just as borderless. And actually, Dr. Brundtland, who spoke at the World Health Assembly at lunchtime today, said what we are talking about are communicated diseases, associating it with the term communicable diseases, and saying, that marketing and many of these kind of cross-border messaging actually helps create the NCD epidemic. So, first point, we need to take this understanding of the global risk society to include different types of risks, which include the risk of NCD. And second important construct, that this global risk society, in relation particularly to the NCDs, is linked to a global consumer society that is created around the world. Now, a global consumer society per se is not purely negative. We all love having access to goods and services, and hopefully they're not too expensive. And if we look at the emerging economies, how people's life has improved, how their access to goods has improved. So this is not saying, my God, nobody should consume anything. It's just also to understand that the political science concept we're working with is a society with specific characteristics, and that is a market society that in its social expression is a consumer society. And that is why if we look at the Sustainable Development Goals, one of the most important Sustainable Development Goals, if we want to address NCDs, is the goal on sustainable production and consumption. because that, on the one hand, takes us right into the whole issue of food and many other goods and services, takes us into both the production of what we eat, and I'll come back to that, and of course the whole consumption area. And of course SDG 12 builds on all the work that was done in the context of the Rio +20 conference, and that indicates, but I can't talk too much about that today, also the links between the environmental threats and non-communicable diseases, and many of those are also consumption-oriented. We love our cars. We like oil. And some countries have reoriented their whole foreign policy because they like oil. And so that is a context that we will need to look at more closely if we are involved in trying to understand the society we live in. And there's, of course, a big literature, again, I can't go into any details, what this consumer society implies, but obviously it implies more. It implies more, it implies new forms of financial management, which I've just expressed here with buy now, pay later, a whole credit industry around the consumer society. It's a 24/7 industry, and it has some new dimensions that I'll also come back to. And some people seem to think, you know, there's a new type of development. Some people say, you know, we live now in the Anthropocene, and if you say what kind of human being is actually living in the Anthropocene, you could say it's the Homo sapiensis. So that's another set of structural components. We've made available to you a graph where we've tried to sort of show the dynamics of the commercial determinants of health, which relate to the drivers, the channels, and the outcomes. Again, we would hope, if there were to be an in-depth group and a commission, that they would look at this more carefully. Of course, the drivers are related to internationalization of trade, but also, and more, and we don't look at that enough, the internationalization of capital. Because if you look at some of the large companies that are now related to the diseases, the non-communicable diseases, they are subject to the interests of major capital firms, of investment firms. The largest conglomerate of beer now resides in Brazil. So it's no longer a north-south issue, this exportation of unhealthy lifestyles and products. And it's the product of capital investment run purely for profit. And if you follow the history of that company, it's very interesting, and it's maybe not surprising that the gentleman who created this firm lives quite close to here in Switzerland. So that also says something about internationalization of capital. There is a demand for growth throughout the world, and for many countries it's absolutely essential they have growth. Think of Africa. There's been a big concern because growth in Africa over the last 2 years actually stagnated or declined. The news now is we're going to have 3 to 4% growth again. Fantastic news for Africa, but the question again is growth in which areas? And we can clearly see a new strategy of the alcohol industry following in the footsteps of the tobacco industry to move into the developing countries. And then you have various, the outreach, of course, of corporations and various channels, marketing, supply chains, lobbying, corporate citizenship, and a whole range of outcomes. What does that mean for our environment? What does it mean for us being socialized as consumers? Because there's a social process going on here. You know, this influences us. And what does it mean for our health? So just a quick look, you know, the drivers, actually then you can group them as production, as marketing, consumption, and retail. And too frequently, when we discuss the commercial determinants of health, we look at the producers. We don't look at the retailers. And again, if you take alcohol as an example, there is, a big Swiss retailer that prides himself at not selling alcohol, but that retailer has another retailer in the family who's actually well known for particularly selling cheap alcohol at the lowest price to consumers. So retail plays an immensely important role in creating consumption patterns for people. And in all these areas, there is significant investment, and the retail, of course, also has a big concentration. If you look at the figures, how supermarkets are expanding in emerging economies, it's a very interesting component. So you could play these commercial determinants through, just as an illustration, in looking, at the food system and all the many components that come together from production to processing, access, distribution, consumption. And another area that actually is an investment area in itself is waste management. So, in each of these areas, you can create growth, you can create profit, and you can either work responsibly for the planet and people, or you can act irresponsibly. So these are just some figures, and they're particularly figures relating to the emerging economies. You can see how the sale of packaged foods around the world has jumped, which would not be a problem. It's great, it makes people's life easier. It's just the composition of those foods that is the problem. The salt, the sugar, and other components. And of course, one of the things that's been particularly in the focus of people is the soft drinks, and we will hear later about how countries are trying to respond to that. There are people that use other terms, and here's just one example from Nicholas Freudenberg, who actually speaks about a corporate consumption complex, and you can see he takes that even further with a whole range of industries. Again, that would be a question to say, if one looks more carefully at the commercial determinants, what kind of products and services and drivers do we want to look at? And a whole range of those things were also looked at in this Lancet report, which dealt more with the political determinants of health, because these are often very important industries for countries. They give jobs, they provide tax income, etc. So the interlink between the political and the commercial determinants is a very important one, and we can't approach it naively or lightheartedly. It really is something we have to look at very, very carefully. We've been playing around with how to define the determinants of health. In one article, we took a shorter one. In the Lancet article that you have, we've said strategies and approaches used by the private sector to promote products and choices detrimental to health, because we feel particularly the marketing has a significant influence on the choices. So if you look at the commercial determinants, you can also say, there are sort of three big pillars: the toxic products, the toxic environment that is created, and the toxic marketing. And all of you will be very, very familiar with the environments and the interlinkages we get then in terms of health in all policies. One of the greatest issues is the ubiquity, the 24/7. This is the strategy of one major soft drink company. Our strategy is to be everywhere. And actually, health people, for a significant amount of time, loved this company. Because this company could go everywhere, it was able to bring vaccines everywhere. It was It could help you reach the last mile if you were trying to bring medicines to people. And the Global Fund to this day is working very closely with this company. But because we are starting to understand the commercial determinants of health better, we're having new tensions in how we approach a company which does good on the one hand and creates problems on the other hand. So again, I'm urging you to sort of think in a complex way about the things that we are confronted with here. And one of them also is what we are seeing in many places, and that's the corporate intrusion into public space. As cities and towns have less and less money at their disposal, new forms of marketing are being created. I mean, if you've been in Venice, in the big square, and you'd think you went there to look at architecture, but then you have a poster as big as a palace for maybe Benetton underwear. That's maybe not what you came to see when you wanted to go to the big square in Venice. So that's one way of intrusion into public space. Another is through the support of certain kind of programs. Now, you know, you can't plaster your advertisements on trees. So the nice thing is you create a sports program for children in parks. And cities are very happy if you pay for that. But then you can put up your flags because you're paying for this program. And smack, you're in the middle of the green space and can do your advertising. So there's a range of things around this ubiquity of consumer culture that's very important. And we need to do also a new type of epidemiology. I love this comparison. You know, the left shows you the distribution of cholera, like I said, the infectious disease, and on the right you have the communicated disease, and that's the density of fast food across different parts of the United States. So again, the way we perhaps try to understand where the origins of these commercial determinants are is quite important. I personally think this is really the next frontier of global politics, particularly around food and soft drinks. And it's becoming even more important because some of those new companies that are linked, you know, also to easy access and social media are making it even easier. You can see here the advertisement from Uber, which is called Uber Eats, and Amazon is moving into the same business, and it says, from hungry to happy in 10 minutes. Now, who wouldn't have wanted that? From hungry to happy in 10 minutes. So you call up, so you don't even have to leave your sofa to go to the burger shop. No, Uber is going to bring it to you. So you can see there are new elements of how we organize our social life that are emerging through all of this that we need to look at much more carefully. My last point is choice, because we introduced that in our new definition. And I believe it's very worrying that whenever we try to talk about choice in the health arena, people talk as if the last days of freedom had arrived, you know, and that it becomes a fundamental debate about individual freedom and choice, as if we were endangering our democratic societies. And there is a question, can one turn that around? Are companies willing to come along to actually turn it around and say, you know, we will take on our health responsibility and we will use all this power that we have to actually create a demand for health, a well-being economy. And that, I believe, is one of the largest challenges, rather than to have, you know, this very unconstructive debate whether a sugar tax is a nanny state or those kind of things. I don't think it brings us public health people further. I don't think it brings companies further. But we have to think about what is the final outcome that we want. But consumers also have a responsibility. Professor Pretty from Essex has, this wonderful quote that I love to use: "The most political act we do on a daily basis is choosing what to eat." And therefore, if we say the personal is political, if we choose Uber to be happy, then there is something we are contributing to the organization of the society. And it's very interesting that private companies argue, don't let bureaucrats tell you what size beverage to buy. But if the soft drink company tells you what size beverage to buy, it's quite okay. So we have moved in terms of political choices to change at least some of the marketing environments. And this is some of the process that was part of the packaging debate. There are a significant number of discussions whether what worked for tobacco would also work if we apply it to food, changing norms, taxing, standards, marketing restrictions, food labelings, all of which are, of course, interactive. And that's, of course, where the responsibilities of governments come in. We feel very strongly that this is not just about the individual choices of consumers. It's not just about the voluntary actions of companies, but it's really about responsibilities of governments for their citizens. Thank you very much.
So, Ilona, that was a great way of setting the scene for today's discussion. We will take some questions here because Ilona will not be able to stay until the end of this event and may have to leave earlier. And so we will allow a number of questions. And I want to start with maybe one or two questions to you, Ilona. I mean, you've mentioned the prospect of, or the possibility of having some sort of a similar initiative on the commercial determinants, similar to what is being done on the social determinants, and that is something that WHO should consider. You've mentioned also some of the interventions that we need to consider in addressing the adverse health impact of the commercial determinants. What is, if I ask you about the framework for moving forward, what are the next steps in us and the international community addressing or starting to address in a more serious way, more effective way, the commercial determinants of health, even in terms of actions needed?
Well, I think there's a number of straightforward actions that we all know we should be taking and governments should be taking. I mean, particularly around the Framework Convention on Tobacco Control. And you have said, the 2011 declaration says that clearly. Also, it creates fiscal space for countries to actually have investments in other areas, which some countries are now also picking up with the sugar tax. There are questions in a number of countries about dedicated taxes, of course, and many things. But if you go back to some of the leading economists that are also talking about introducing or ensuring universal health coverage throughout the world, like Larry Summers, etc., they all come back to fiscal measures. And they say that, the way you can create this kind of income, because other forms of taxation are so difficult because of the high level of informal work in many of the informal emerging economies, you have to pick up other measures of taxation. And through that, you get money to invest in your health systems, pay vaccines. Gavi is exploring this. The Global Fund is exploring this. I think that's one thing. I mean, there's things we know and we need to work very, very hard that they are accepted, that they are implemented, that they are moved forward. The other side is really, I think we have a responsibility in the 21st century to sort of rethink our public health approach. And that's why we're saying we don't have the solution yet to this commercial determinants thing. But we want to say, if we live in a global consumer society with all kinds of impacts, we have to think hard what that means for health. And we have to think hard what that means for companies. We need companies. They give us jobs. They give us income. They do all kinds of things. But we want that process to be one that supports health and not, destroys people's livelihoods. And the question is, how do we go there? And therefore, I think to sort of move out of some of the old public health debates, here is the enemy, and here are all the good guys over here, that having a really serious discussion what this means is the only way that we can take this further. And this is a discussion where you need, interdisciplinary academics to contribute, you need civil society, you need forward-thinking companies to contribute, and you need governments that have taken risks in introducing new kinds of instruments where everybody said, well, should you really be doing this? And those can be city governments, they don't need to be right on top there. So I think that's why we're saying we should have such a commission, and such a commission could, be really put together. If you think of, one of the companies we tried to invite and it didn't work out is a major insurance company. And they have decided to disinvest, first of all, in oil, and then they've decided to disinvest in tobacco. So, and, people are challenging the Bill and Melinda Gates Foundation to look carefully at their investments and to say, we will not put our money here. But if we talk about all this, we have to understand that your pension and your pension and your pension is invested in tobacco, because that's what pension funds do, because that's where the profit is. So I think, those are the kind of financial streams and dynamics we have to start to understand, instead of, as fascinating it can be, to identify an enemy, a company, and fight against them. I've done that in my youth as well. But to actually say, what are those streams? And I personally think those investment streams that are happening right now are perhaps, deserve much more attention than maybe some of these, production issues or sales issues that we've looked at so far, because they're driving it. There's practically no family company left anymore. They belong to the big investment companies.
Right, let's take some questions, comments. Yes, please. There is a microphone here. But,
yeah, I can take two and then I have to go.
Yeah.
Yeah.
Hi there. Thanks you so much, Ilona and Alla. I'm Johanna Ralston. I'm past CEO of the World Heart Federation and now a fellow here at Geneva Center for Security Policy and working on NCD issues as well. Thank you. That was a fantastic presentation. I think the fundamental issue, and I'd really welcome, I guess, a little more thought from you on this, is how do we change shareholder demand? Because that's the fundamental issue that companies come up against when, in theory, I think many companies actually want to, be more health enabling. But how do we change that one piece other than working with pension funds, who, as we know, are the largest investors in many of these companies? What are some other measures that can be taken? Do you have any thoughts on that?
Well, okay, and one more, and then I'll, because I...
Comment, questions?
There was one here. The gentleman here had a question, or a comment, or whatever.
Well, we have two then now. Yeah. Yes, please, gentlemen.
Thank you. My name is Mike Dünbier of IOGT International. Ilona, thank you very much for such an outstanding presentation. I want to just quickly re-emphasize the point on retail you have made. We work with alcohol control, evidence-based alcohol policies. And just in Iceland, we can see an attack on the Icelandic alcohol policy model led by Costco, one of the biggest retailers in the world. I want to ask you, Ilona, picking up on the point about choice and our liberal democracies, and you talked about the public space, is it not correct to say that the way the corporate consumption complex works in the end is an attack on public space and on democracy, because we can see that citizens are being turned into consumers? What would you say to that kind of thinking?
And the last comment, maybe from the, yes, please, over there.
Let me add my thanks to a very interesting discussion already. I'm Susan Wilburn from Healthcare Without Harm, and we're working within this health sector to look at more sustainable products for procurement, whether it's UN procurement of health products and services or hospitals, public health, and private health systems. And one of the major challenges that we face is a lack of transparency among the chemicals and pharmaceuticals that are bought by health actors. And this is another, in chemicals, another $4 to $5 trillion industry that the producers of products that contain toxic chemicals say to us, we don't know what's in our supply chain. And it requires, and there has been a whole movement around the chemical footprint where retailers have been trying to track the components within their supply chain. And these are carcinogens, mutagens, reproductive hazards, asthmagens, all sorts of chemicals that if we knew what was in the products, particularly under the principle of first do no harm in a hospital or in a healthcare setting, we wouldn't be using and buying. Can you comment?
Ilona.
Thank you. Just three very short answers because I have to rush off to this next thing. First of all, Joanna, I think we need to refocus our advocacy, who we actually want to reach. I think, for the last 10 years, we've been doing our advocacy on the same people. And maybe it's time to change. And, one thing is, if the majority of pension funds acted differently, we'd already have quite something going. And that's also the issue, who do we address nationally and who do we address internationally? We focus so much on the companies that we've not looked at the financial flows. And I think one of the key things we have to do if we want to be good advocates is understand the financial flows. And that's why our definition of global health is all about flows. It's about flows of people, capital, finance, etc. It's not just trade. It's something else. It's an enormous dynamic. And I think if we were to do more of that and relate that to the SDGs and sustainable consumption and those kind of things, we would get a different macroeconomics of NCDs that would be truly interesting. The second point is, I think what you say applies to basically all goods, consumer goods, medical goods, etc., in terms of their composition and how they are used, and also the irresponsibility partly of the health sector in relation to what it is using. If you look at some of the initiatives around green hospitals, etc., and hospital waste, it makes an enormous difference. And their governments are called on, to really expect, or bodies like the European Union, that there is declaration of what is in products, whether it's a piece of bread or a complicated cleaning fluid or whatever else. And the third point is, yes, there is quite some discussion about, do we have citizens or do we have consumers? I think the discussion, if you look at it politically, about sort of pushing up the importance of whether I have free choice to buy a bottle of beer at every point of the day and in every what you call these things on autobahns, the Raststätten. Whatever, the amount of public debate that is invested in 24/7 access to things everywhere, as if that were the ultimate thing we're looking for in our democracies, that we have every access to every product at every point in time, rather than to ask, what is the access we want to political decision-making at every point in time, at every level of our lives? So it's it's a distraction, I would say, that we should also be much more concerned about in terms now of political theory also, and how our political parties should also be acting, and how they position things. Because the thing that should be most important to us is our political voice, and that's the voice we should be using to move agendas like this forward.
Thank you very much. This has been an excellent introduction. I'm sure that we will be revisiting this issue between now, several times between now and the next UN meeting. So we have now a great panel. We have three distinguished panelists in this event. The Honorable Minister of Health in Chile, Carmen Castillo. We are really grateful and privileged to have you here with us today. It's been great. I mean, we thank you for making the time to come here, and we look forward to listening to you on the position and also the actions of the government of Chile on this extremely important issue, and also on promoting behaviors. We have Rocio Rinaldi. He is the Secretary General of the International Food and Beverages Alliance. Yes. The Alliance has declared a number of commitments to support NCD prevention and control since the 2011 high-level meeting in New York. So we'd like to welcome you, and we'd like to thank you for being with us, and I hope that you will enlighten us on the position of the industry, the food industry, in terms of the impact and also in terms of the concrete outcomes of these initiatives. And we have Katie Dane, who is the Executive Director of the NCD Alliance. Katie, great to have you here. We want to know, of course, from Katie more about what the Alliance is doing, but more generally on the role of civil society in this area of work, and the engagement of the civil society in addressing the issue, particularly over the last 5 or 6 years. What has happened since 2011 in this specific area? And then we will turn to the floor. We will have questions and comments from the floor. Obviously, to respond to the input generated by the panelists, but I would like very much that the floor also make some comments on the way forward. And as I was saying to Ilona, it's extremely important that we identify exactly what the next steps are. We need to scale up action against non-communicable disease in a number of areas. And as I said, we have identified 5 or 6 areas where more needs to be done, and this is one of them. So I would like to encourage the audience to share with us their own views on what is next, what would they like to see happening, particularly between now and September 2018. So let me start by asking the panelists to please move here. And maybe we start with Your Excellency's presentation. Do you want to do it here or there? No. There. Katie. So, Your Excellency.
Thank you. Good afternoon, all colleagues, honorable and distinguished guests. Thank you for inviting Chile to share our experience implementing national measures for improving healthy eating. Just to tell all the audience that we have done the first step, and that's what we want to show now. Chile needs to tackle rising obesity levels. We are the most high overweight and obesity in South America now. 1 of our 4 adults is obese, and 2 from our children in the first class is overweight or obese. So we had to do something rapidly. We couldn't change culture. We couldn't make many decisions only by good talking. We had to be concrete. Huh? And I'm very grateful what Dr. Kickbuch told us, because it has a same thing what we have done. Well, in Chile, we developed and implemented legislation to address food nutritional composition and food marketing based on 3 pillars that are here shown. One is the front packages labeling warning. One is this. The second is restriction of unsafe food environment in schools, all the schools, private and public schools. And the third one is restriction of food marketing to children under 14 years old. Nothing could be done for give food with something that the children under 14 could receive as propaganda. Okay? We implemented a black warning, like the stop sign, that food labeling in the front of the packages, as you may see in this screen. We made a focus group in Chile, in many parts of our country. So this was the most impacting thing that the people saw, that they could sign rapidly what was going hike in calories, hike in fat, hike in sodium, and hike in sugar. We established incremental limits, no loud. We established, loud. Te fuiste muy rápido. Pata. Ya, ahora sí, loud. Aquí. We established incremental limits of food composition for solid and liquids based with a common number, 100 milligrams or 100 ml, nothing more. Because when you say how much it is a portion, you are always in different ideas with the enterprise, with the different consumers, so it's different for all of us. We expect in 3 years' time to reach our gold standard. In 3 years. We began the last year, in June 2016, this new law. So all foods with added sugars, honey, sugar, syrups, sodium, salt, additives, and saturated fatty acids, any oil or fat, and its contents that exceeds the limits established by the Ministry of Health get a frontal black labeling. That was for all of them by law. So this is how the products look in the supermarket, and you can see it's instantly something that you can detect its hike in. Something that the children could see too, because they are our inspectors. When they go with their mother or father to buy, daddy, it's hike in, and they choose a different food. It's very important for us. The second strategy is restrictions and advertising of hike food to children under 40 years old. Foods that exceed cutoff values cannot be advertised to children under 14 years old and includes foods all foods hike in like the stop sign. Advertising that target children and teens under 14 years old is law. Anywhere through television, radio, public space, magazines, internet are forbidden, all, by law. These products are banned, forbidden, use items focused on children under 14 years old, such as characters and child figures, animations, cartoons, children's music, toys. Totally forbidden. This is the new look of the packages after implementation with this legislation supported by the industry. The change in Easter that was, the children, they couldn't believe it, and the mothers and fathers too. The third, son tres. There's another before, after. Mira, ándate para atrás. Sí, muéstrale. Sí, no, ándate la tres fotos. No.
The next slide.
No. It's before, after. Before with a player, now only the stop sign. El otro. Okay. Hike in foods, packaged or not, shall not be expended, commercialized, marketed, promoted, or advertised within local nursery, primary or secondary education schools. After 6 months of implementing the legislation, we develop a plan for monitoring and controlling it. First, local sanitary authorities supervise the implementation according to technical guidance. Second, we monitor the inclusion of the labeling in the products with the enterprises and retail. We monitor it. We get to arrange with them that in 3 years we're going to change all what we want. We are not only beginning. It's not the end of that I am telling. Yes. In schools, we prioritize supervision of local points of delivering of these foods in the most vulnerable schools. The penalties went from admonitions or bans up to products recall or closure of the industry or retailer with different economic penalties. $7 to $7,000. 70,000. We conducted an evaluation by citizen perception of this policy. 93% of the surveyed population recognized the logo. We did what we did. We have to make a law. Why did we have to make a law? To have this change of culture. We had the chief manager from Burger King in Chile, from McDonald's, from Kinder Sorpresa, Ferrero in our country, and we told them why we wanted to have this change, because the future of the children was to have NCDs, and we don't want to have them. This is why Chile we can do it. We have more than 70 years from public health, strong public health, and it's over something very strong that we can do something like this. The 67.8% acknowledged that they were influenced by the logos and that they choose products with less logos. What have we learned about this? First, there was a political decision to legislate regarding obesity under the leadership of parliamentarians and academics, what Dr. Kickbush told us. Second, the law was approved by the different political sectors. All we were together in this idea, in this law. Considering the Minister of Health is in charge of the implementation, we agreed with different sectors, mainly the industry. We have to talk with them. We talked about 2 years or more to get at the end of this idea. The roadmap to move forward. The strategy to overcome barriers included dissemination of epidemiological data in regard to overweight, morbidity, mortality, DALYs, especially children. Scientific evidence and reports of recognized international organizations were used. Finally, we acknowledged the importance of leadership, the use of sound technical background, the importance of developing network and partnership, advocating and at different levels and monitoring the implementation. That's my presentation. Thank you.
Wonderful. So again, another great presentations, and I must congratulate you, Minister, for the commitment to NCD prevention. If we compare the kind of political commitment or the level of political commitment that we had before 2011 and now, there is definitely a huge increase and improvement in people, policymakers at the highest level recognizing the seriousness of NCDs, not only in relation to health, but also in relation to socioeconomic development. And so if we look at the data we have today, a huge difference. You know, most countries are now committed. The issue now is translating the commitment into concrete action. And I think this is an example of translating this kind of declared commitment into some concrete action that is going to have an impact on NCD prevention. So I want to congratulate you and the government of Chile for this. I'm worried that because of the shortage of time, we may not have time to maybe have some questions to the participants. So I will allow, originally we're planning to have one, part of at the end of the presentations, some questions and answers, but I would like maybe to allow 2 or 3 questions to the Honorable Minister, and I will do the same with the other 2 panelists, and then at the end we will have some general comments. So, my immediate question to you, Minister, is the kind of response that you were able to get from other government sectors. In many countries, experience shows that it is not just, that we have to deal with the corporate sector, but we have to deal with the other sectors within government. And I think Ilona mentioned this in her point. So what was your experience? You need, of course, to provide the evidence to them, and because they have conflicts of interest too, and it would be important that you engage the key sectors in government with you in your initiative. Did you have any difficulty in this? And the second quick question I have is in relation to advertising. You managed to pass legislations on advertising, particularly for children, and you are obviously in control of the national media outlets. Are you finding any problem with cross-border advertising, particularly in relation to the television channels or other media outlets that come from outside your country? So please.
Hello? Thank you. Well, the responsibility from other sectors, from the government, the most problematic thing was economy, because they thought we are losing a big part from, income that's going to come to Chile. I only say that all the food that comes from outside chocolates and all these delicious things, they must put the hike in all the products. So when you see bitter chocolate or all the exquisite things, you have the hike in. We have parliamentaries, they helped us fast, in senators. And we academics, universities, all were together with us. But we had a long talk with all of them. So it's perseverance, the key word.
Sure. On the media?
In the media, we look forward that there can't be Chilean television with this, because we see international television and we see the products, they want the children that they can buy all these products, but we don't have it in Chile now. Okay. And we control it. And in the first 2 months, we had about 1,200 control in supermarkets and in different ways, schools, and it's going on. Nobody wants to be behind this.
So 2 or 3 questions. Yes, Gianluca.
Thank you. Minister, thank you very much. Fascinating presentation and congratulations for what Chile has achieved. It's not easy to find the political support within a country to pass a law so ambitious. Now, my question is, what kind of challenges are you facing or have you faced? Tobacco has shown that the industry has attacked from the point of view of investment treaties and trade treaties, WTO treaties, bilateral investment treaties, and so on. The industry has been unsuccessful until now, but it's always, in a way, a strong way of attacking this kind of measures. Have you faced this kind of threats from the point of view of investment and trade agreements?
Some more questions? Of course. I was expecting you to intervene.
Sorry, Patty Randall from the International Baby Food Action Network, and I'm thrilled to know about what Chile has done. But I was particularly interested in the schools and the way that the strong political commitment that you had to clear it all out, these messages. And that, I presume, means that you're not going, I mean, where we are in the WHO now, everything's multi-stakeholder, everybody's thinking that they've got to do in partnership and have consultations and consensus decision. Clearly, Chile decided that this was not going to be the right thing, or was the 2-year delay, did that mean that you did have to get agreement, in which case, down the line, you would have preferred to do quite a bit more, and possibly will do quite a bit more, because this is where we see the whole thing is the industry wanted, and Rocco knows he'll start speaking soon. We have these discussions about how far can countries go, and then my last thing was the small farmers and the local. When you think of Brazil and what Brazil has done, and the emphasis on non-processed food, is that something again that you're looking at? So not just the processed foods, but literally encouraging in schools non-processed foods. Thanks.
Yes, please, Francisco.
Thank you, Minister. Did the industry change their products as a result of your law?
So you have 3 questions. Did industry change their products? Reformulation? How far can you go? And what kind of challenges have you come across?
I come from the last question.
Yes.
20% of the enterprises changed before we began with the law, the products, the contenidos. So we thought, why do we have to make a law? Something that wasn't so difficult to change. Now there are many other, only yogurts, they're not with hike in nothing. So we think we can get together in consent with all the industry. That was perseverance and not to fight. It's not the idea. It's to get together that we have a common future. Their children, our children, all the children from the world need a change. Not we, all. So that was not easy. I think we had in contra, against many people, but we had to talk with them and get in consensus, especially in the food for the children, because we changed all the products now. What we are giving the children as a free alimentación, yes, in the schools. So now there are more salad that wasn't before. So it's a change. And about tobacco, the same. We think we have to be always aware and always listening what are we doing and how we are doing it. But all together, it's not a fight plan. It's something that we have to change our world now. Just in the morning I told, when you see the portion from our portion before and now, it's much bigger. And you see the portion from the Japanese, it's tiny little. That's why they're thinner. So we have to change. So, excuse me, that's the idea.
Thank you very much. So we'll have an opportunity to maybe pose more questions to you, Your Excellency later on. But let me now invite the Alliance, and again, a brief presentation, and we will have some quick questions and answers. So the commitments of the Alliance in the food industry, and where are we now? How effective have we been? Please.
Thank you, Dr. Alwan. Let me just start by thanking the Graduate Institute for inviting me onto this panel and to be part of the discussion today. And I want to start by giving you a little bit of background about the International Food and Beverage Alliance, IFBA in short. It was founded in 2008, and it counts 11 of the largest international food and non-alcoholic beverage companies, so from Coca-Cola through to Unilever, in alphabetical order. And IFBA was established to bring together the leaders in the industry, essentially, in order to address the rising challenges of obesity, of NCDs, in a proactive and a constructive manner. IFBA is based on three main insights, I would say, by the leadership of these companies. The first is that there is a recognition of the global public health burden of NCDs, and also the role of diet therein. The second is recognition that industry, and in particular the industry leaders, have a responsibility. And the third is a commitment to play a meaningful role in concert with stakeholders. So it's on this basis that the CEOs of these companies made a series of global commitments, in the first instance to the World Health Organization, back in 2008, and they were renewed with some additions in 2014. The commitments are about continuous product improvement through reformulation, through portion size control, and through innovation. The second is about responsible marketing, with an emphasis on limitations on marketing of high-fat, sugar, and salt products to children. The third is about the provision of nutrition information to consumers, on-label and off-label. And the third is a promotion of healthy lifestyles, starting with the workplace and broadening out to communities. Now, these commitments reflect closely the call that was made in the UN Political Declaration on NCDs of 2011 on the private sector, as well as the current WHO action plan. Paragraph 44 of the NCD declaration, many of you will probably know it, refers to what the private sector is called upon to do. Now, these are commitments that my member companies are implementing globally, but also we are promoting their adoption and implementation in broader industry fora at the national and the regional level. Bearing in mind that the industry is very diverse in many countries, and our companies, while large, are not necessarily the decision makers in those organizations. Now, the implementation of these commitments is not fully complete. It's not perfect. I'm sure the commitments can also be improved and will be worked upon further. But they are a basis that brings these companies together and is also intended as a basis for meaningful dialogue with the WHO and with stakeholders about the role of the private sector in the equation. IFPA also is committed to accountability and transparency. We supported the adoption of the Framework for Engagement for Non-State Actors of the WHO already in its early stages. And we welcome its implementation now, even though we're perfectly aware that it calls for extra caution in the engagement of the public health players with industry and organizations like ours. This because we recognize the need for WHO to preserve its independence, but we also believe in the necessity of dialogue and cooperation between the public and the private sector to help solve NCD challenges. Now, let me share a few considerations on the commercial determinants of health. It's a shame that Ilona's no longer here, because as a good student, I studied her article that was shared before the conference, before coming here, and I have a few thoughts about that and about the concepts that she presented earlier. So, of course, it's important to examine how the economic system impacts health outcomes, whose interests are aligned and whose interests are potentially in conflict with the public health objective, and what can be done to overcome the obstacles. But I want to give the perspective as Secretary General of IFPA, but more broadly of someone who's been working with different companies and different industry associations at the intersection of business and politics for a number of years. And my first thought is that the private sector is not a monolithic entity, and neither is something like the food and beverage industry. It's a very diverse sector with very different viewpoints and interests within it. Often, the multinational companies are in the spotlight because of their size and because of the visibility of their brands. But especially in lower and middle income countries, typically they account for a small share of the market. And indeed, there is growth in trade, and in some countries, market shares are changing, etc. But take India, for example. The stomach share, if you like, of packaged foods is in the range of 8%. And that includes not only the multinational companies, but a range of large domestic industries that make packaged foods. So non-packaged food is still about 92% of what people eat. And this is very different from one country to another, from industrial country to emerging market to different types of situations. So engagement with the broader industries at the national level, which are often dominated by national players, is very important. And this is part of my job, but I think also a message that I want to share with you as a general principle. Also because awareness of NCDs and the implications for the industry, this awareness differs significantly within the industry and from country to country. So there is still a job of actually raising awareness in the broader industry settings in many countries around the world about what the problem is and what industry can actually do about it. So to be useful, a political economy analysis such as that on the health determinant, the commercial determinants of health, it needs to take this diversity into account. My second point is that companies are part of the system in which they operate. And this was emphasized also by Ilona earlier. What I want to emphasize there is that companies, they will adapt and they will evolve with the system. You can already see today strategies adopted by some of the leading companies So to name but a couple that are quite well known, the Unilever Sustainable Living Plan or the Nestle Shared Value Strategy, for example. These are not CSR strategies that are intended to deflect attention or whitewash a reputation. They are actually core to the business strategy that these companies have decided to pursue, and they will succeed or they will fail commercially on that basis. So I think those are important and interesting case studies. But these pioneering companies also need to be supported by political leadership. And importantly, policy action that drives positive change. So one thing is the option to regulate, and that's a prerogative of a sovereign government. But in addition to that, I think there is a need to actually foster that change in companies' business strategies. Because unless you create a systemic change, as was said earlier, also in the investment community, then you may affect the consumption of a certain set of products, but you won't have a sustainable change in a particular direction. So government leadership is also important, and I want to emphasize, like Ilona did earlier, the importance of looking at the commercial drivers also in the context and against the background of the political determinants of health. And by that, I mean on the food sector, but also way more broadly about all the other components that determine the food environment and more broader, the social environment in which people live and make choices. My third message is that IFPA companies don't oppose regulation as such. They're focused on outcomes. So, of course, a company, there's been a lot of discussion on this, on taxation. A company whose product is about to be taxed will not be thrilled about that prospect. I think that's natural. And there's plenty of legitimate considerations about the effectiveness of different regulatory and policy approaches. But overall, there's no ideological consideration within these companies about whether regulation, self-regulation, co-regulation is preferable. And there's plenty of examples of regulations that we support. Ultimately, it boils down to the respective views on what is appropriate, proportionate, workable, and what are the multifaceted impacts of any intervention. Now, when it comes to defining these regulations at national level, there's often heated debates, there's a polarized discussion that often takes place, and companies won't always get it right. They will make mistakes. But I think looking at the broader picture, disagreements about specific measures should not stand in the way of joint multi-stakeholder action where that is desirable and possible. We should also avoid a reductionist interpretation of reality. The article that was circulated before this event said health outcomes are determined by the influence of corporate activities on the social environment in which people live and work. Now, no doubt industries impact this environment, but to state that this influence determines health outcomes is overstating it, because it doesn't account for why NCDs are growing at the same pace in countries with very different food systems and also very different political economies. So we need to look at that. Lastly, there was another statement which is about the rise of NCDs as a manifestation of a global economic system that currently prioritizes wealth creation over health creation. And I think that needs to be qualified, because the issue is that we actually also need wealth for health. And to echo what Dr. Chestnov said at another event here in Geneva this morning, the two can be and need to be reconciled. And progressive business strategies that seek to reconcile those two is what IFPA is ultimately about. But that's a long and difficult process. And this reconciliation, in my view, can only be achieved through what the political declaration, the WHO action plan, and the SDGs call a whole of society approach. Thank you.
Rinaldi, thank you very much. That was a very informative presentation. Again, we will have a number of questions. I want to start by saying that dialogue with the industry is exactly what has been happening since 2006 or 2007, with a roundtable established with the industry, and I, as Assistant Director General responsible for non-communicable diseases for a number of years, and until 2012, this has been a very useful mechanism for collaboration. So I just want to respond to the first point that you made. And I want to ask a question in relation to the second point you made, which is the fact that companies will adapt to embrace healthy options. And my question to you is, what kind of environment is the industry looking for so that they can move faster in this direction? What is needed for the industry to adapt to enhancing action or accelerating actions on healthy options?
Thanks. I would, a very concrete example, if you're talking about product improvement, I've been part of many experiences where government is the convener, and government takes the leadership to put stakeholders around the table, including the industry. And for example, on reformulation, this has been done in several countries to different degrees of success. But to take an example of the UK, for example, this resulted in a 40% reduction in salt through a government-led initiative that asked companies to do this publicly, naming, praising, shaming, whatever, and actually getting them around the table to do that. What companies need is a comprehensive approach.
It didn't happen with other initiatives, though, in the same country, for example.
No, and each initiative has its own problems, and there are different dynamics that may work or not work. But I think what we need is the role of government as a leader and as a convener, and also, I would say, providing incentives, so some carrot as well as stick. You may achieve something with a stick, but the systemic change you will achieve with a carrot. More broadly, there was discussion about the investor community and where do investment flows go. It is true, most public companies today are largely owned by investment funds, pension funds, as well as private shareholders. There is a new index called ATNI, not that new anymore, it's about 5 years old, but it mirrors the access to medicines industry. It's an access to nutrition industry that seeks to influence, it ranks companies and seeks to influence decisions that investors make. Those are all useful tools because, as I said, companies are actors. They're not ideological. They're not here to say, I want to sell this product and that's it. No, they will see an opportunity and they will pursue it.
There are situations where there are some double standards in implementation of action taken by specific industries. So, for example, commitments implemented in some countries have not been consistently implemented in others. What is the role of the alliance? I mean, since this is an alliance of leading commercial manufacturers in the world, what is the role of the alliance to see that this kind of inconsistency does not happen?
The best we can do is commission monitoring to report what is happening and highlight problems, breaches, etc. Now, to do that on a global scale is actually extremely difficult and expensive. So what we've been able to do to date is limited and, frankly, not really good enough. What I think, frankly speaking, needs to often improve within companies is internal governance so that these principles and commitments are applied equally across the world. So this is something we strive for. The reality is that is not simple. I mean, a company of that size essentially functions a bit like a national government. There is a prime minister and a set of ministries, and the reach is such that actually to trickle everything down to everybody takes time. What we do is promote best practice. So, for example, on marketing, some of the companies have now appointed a global responsible marketing officer whose sole responsibility is to actually implement that policy, by which each marketing person in the company has to pass a driver's license. It's called a test every year, so that they're completely aware of what they need to abide by. This needs to be included in contracts with advertising agencies. It needs to have the broadcasters on board and so on. So,
I have two questions here. Yes, please. Yeah.
Hi, my name is Elena Matsko with the NCD Alliance. I think my question goes a little bit into into a similar direction as your last question, but I'm interested in the face of this obesity and NCD epidemic, in particular when it concerns children and adolescents, and given that you very much recognize the leadership role of governments here. So in your setup as an alliance, what is IFBA doing when faced with questionable practices by one or several of its members when it comes to diluting the science or opposing the WHO recommended measures, or even government implemented, or the policies that government is trying to implement? Is there certain peer pressure among companies, or is there something specific, some sort of code of conduct, or something that the Alliance is actually doing to address these issues that are quite well documented in the media at this point?
Thanks very much. Sorry, me again. Rocco, we see each other a lot on the Platform for Action of Diet and Physical Activity in Europe, which I've sat on for about 10 years and heard many of the commitments that IFBA and the European Food, all these commitments by industry, and they're always weaker than, and naturally so, they're weaker than what I would like to see. I mean, for example, I mean, my guiding principles is what happens at the World Health Assembly. So on infant feeding, we know that the code and the resolutions are absolutely the minimum. Now, the companies that are involved with IFBA or the EU pledge, they never reach that sort of level. It's always sort of under, and it involves, in fact, you said it yourself, you expect engagement from all of us to help with the sort of internal problems and struggles that you have within each country. That means that we almost have to sort of buy in to the actual commitments that you say, and the commitments are never as good. I mean, we've had huge struggles over marketing in schools or education in schools, because that is the way that some of your companies absolutely see the way that they can get to parents, to children, and say, we've got a slightly better junk food, and I won't call it junk food, but the chocolates is less sugar, or this is less sugar. So you're leading everybody into thinking that the products actually are healthier. And my worry is, and that's why I asked the question to the minister, is really those of us who are really concerned about health would like to see less processed foods. We would like to see real food, not the processed foods. And the companies that you're responsible for and that represent are actually mostly highly processed foods. So that's the difficulty we have, and the difficulty of letting those companies that I see round the table in any sort of shaping of nutrition policies. I find that incredibly risky, particularly because of the power and the size of the companies concerned. So that's why we're always in this sort of struggle, because I can see it from your point of view, but from my point of view, it's really scary. So even if you went and did that all over the pledge, all over the world, it wouldn't solve the problem, in my view.
So last comment or question over there.
Thanks very much, Rocco. My name is Patrick. I'm a medical student from Australia. Thank you. So thanks very much for your comments. I think it's a really interesting perspective on NCDs. I think engagement with the private sector and the food and beverage industry is important to make progress in this space. My question is regarding the companies that IFBA chooses to incorporate into its membership. Do you think there are certain companies, for example, Coca-Cola and PepsiCo, that whose economic success is fundamentally incompatible with the promotion of health?
Okay, so Rocco, would you like to respond?
I think the first question was about what do we do when a company misbehaves. So that's something that goes against the spirit. I don't have a sanctions mechanism. If they do something repeatedly that their peers consider is out of order, then we would ask them to leave the alliance. There have been cases where some companies, have done certain forms of lobbying that I would not agree with. On the other hand, the world's a big place, and as I said earlier, when these discussions happen in a national context, there is a democratic process whereby inevitably industry, NGOs, everybody else expresses their views, and whatever companies advocate in that context needs to be seen in that context. I can't actually affect that. When it comes to the World Health Organization, we have a joint commitment not to do that. Yeah? But me, Rocco here, I cannot control what happens from Chile to New Zealand. We seek to put in place guidelines for that internally within the companies, and those will help. But again, the world's a big place, and there is room for disagreement with certain policy initiatives, and including some recommendations from the World Health Organization that will be voiced at a national level. To Patty's question, I mean, you don't have to agree with the commitments. I know you would want to see a standard that is very different. I want to underline that these commitments evolve. I'm in the business of incremental and continuous change. I am not a regulator who is there to set a standard for a country. And so those are very different roles. So you're obviously free to disagree with that and even consider those commitments worthless or whatever. I don't think that they are, and I think they're part of the mix. And I would add that at the end of the day, governments have the authority to follow whichever line they think is most appropriate. From the industry, it's a case of enlightened self-interest. Very briefly, the last question. No, I don't think that's a valid statement, because food is not tobacco. This is why I think, with all due respect to Her Excellency, the Minister of Chile, plain packaging for an Easter bunny is not the policy option that I would support.
Okay, I think it's now time to move to the last presentation, Kate, and the role of the civil society organizations.
Thanks, Ala, and good evening, everybody. So the NCD alliance that I represent is quite different from the other alliance on the panel. We're a civil society alliance of 2,000 organisations in 170 countries. I think many of you already know who NCDA is. We've been around since 2009, originally set up to really call for the UN High-Level Summit on NCDs in 2011 that Ala was referring to earlier, and obviously have played a key role in advocacy, particularly ever since, and we continue to have a really strong focus on global advocacy, because we recognise that whilst NCDs are very much higher up the political agenda than was 10 years ago, we've still got a long way to go. And as Ala said earlier as well, I mean, what we see as the main challenge now is really translating the commitments at global level down to the regional and the national level, most importantly. The other important kind of evolution of NCDA over the years has been that we now have a growing and flourishing network of national and regional NCD alliances around the world, which we're really excited about. We can now say that a quarter of all countries have a national NCD alliance, which is quite impressive when you think that 5 years ago we had around 15, and suddenly we've got over 50 national NCD alliances, which are bringing together all the civil society organisations from across the disease areas as well as the risk factors areas, and most importantly often have patient groups within their midst. So the national and regional NCD alliances for us is a major focus for our work, and we're doing much more in terms of capacity development of civil society organisations at the national and regional level. In terms of the discussion today, obviously in terms of the role of the private sector in NCD prevention and control, it's already been mentioned that obviously the 2011 political declaration really emphasised the role of the private sector in the response. Paragraph 44 that all of us policy nerds know very well, and I'm not going to explain what paragraph 44 is. Since then, there have been some important evolutions in terms of the way that we think of private sector engagement. For example, the WHO Global Coordination Mechanism that's here this evening with Guy here convened a working group a couple of years ago on the role of the private sector in NCDs, recognising, I think, very much that it's still an issue that we're still grappling with in the NCD community. More recently, we have had the long discussions around WHO framework for engagement with non-state actors, which obviously has within it how we should be engaging with the private sector in terms of how WHO works. And we've been grappling with it from the global level and the national and regional level through the national and regional NCD alliances, particularly. I think it's important to mention that obviously tonight, when we're talking about the commercial determinants of health, we are talking about a specific part of the private sector. And I agree with Rocco when he said that we can't look at the private sector as one homogenous group. We've got to really be a bit more nuanced in the way that we're looking at it. But this evening, we're really talking about parts of the private sector whose core business directly impacts upon NCDs, which is different from other parts of the private sector where there's less conflict of interest and they clearly have a role to play. And I think we need to be nuanced in the way that we address these issues. So while the tobacco industry, as we all know, has long been excluded from engagement to date in NCDs, although I have to say that I was actually at an event earlier, and I won't say which one it was, where it was an NCD discussion organised by private sector, where actually there was quite a lot of discussion about if we should be engaging the tobacco industry, which was slightly alarming, I have to say. So maybe we need to do more in educating our private sector colleagues about the dangers of the tobacco industry. Unlike tobacco industry, there is no clear global guidance on how to engage the alcohol and food and beverage industries, which has obviously been part of the FENSA discussions. What FENSA does do is it stipulates that particular caution should be exercised when engaging with the unhealthy commodity industries. And what the GCM's working group report did on private sector engagement was its first recommendation out of a number of other recommendations put front and centre that governments need to establish sound national statutory and regulatory frameworks as a basis for enabling more concrete contributions from the private sector entities to NCD prevention and control. And for us, this is really important, that recommendation. Engagement with the private sector, from our point of view, has to be first and foremost government-led. And secondly, the private sector has no role in terms of policy development. They shouldn't be at the table. Whereas dialogue is one thing, policy development is the pristine role of governments, and the private sector has no role. In the same way that WHO documents such as the delightfully named Appendix 3, which is being discussed this week, obviously we all know it's about priority cost-effective interventions for NCDs, and as well the ECHO implementation plan, so the childhood obesity implementation plan, reflects that self-regulation is not a recommended strategy. The experience of our national NCD alliances around the world, particularly in low middle income countries on the ground, shows very clearly that with very few exceptions, voluntary approaches and self-regulation does not work. and in fact results in deferral of effective regulation. Instead, what they do, these documents that WHO has developed with experts, is that they recommend a comprehensive set of population-based policies, regulation and fiscal measures, which have been proven, are evidence-based, and really is what we as the NCD Alliance focus on. I think it's also important to note that across the NCD risk factors, which this is really what we're talking about when we're talking about commercial determinants of health, is we're observing inappropriate practices of the unhealthy commodity industries, which are at this point very well documented. For example, Elena already mentioned one earlier, undermining honest science with dubious scientific reports, exploiting of the complexity of the science around NCD risk factors, positioning themselves as change agents and partners in the new era of sustainable development, many seeing the SDGs as a real opportunity to be getting more involved, as well as through elaborate corporate social responsibility strategies, unethically marketing, in particular to children, obviously impacting upon childhood obesity and increasing things like diabetes at a much earlier age in low middle income countries, and lobbying against effective policies, regulation and fiscal measures such as taxation. We're seeing this time and time again. And what we can see is that many of these tactics and strategies are very much being drawn from the tobacco industry that we have seen time and time again over the decades previously, and still today, in fact. Just last weekend, at the beginning of the World Health Assembly, we as NCDA convened an advocacy workshop for 5 of our national NCD alliances in what we call our accelerator countries, which are South Africa, Brazil, Mexico, Colombia, and India. Time and time again over these 2 days of this workshop with our alliances, talking about advocacy strategies and how they work as coalitions and all of the things that we as NCDA now do a lot more in supporting national and regional alliances. Time and time again in these 2 days, what we saw was the issue of industry interference coming up time and time again across these different geographies and regions. We saw at last year's World Health Assembly firsthand how industry is intercepting the endorsement of the WHO guidance on appropriate marketing for foods for children and infants. And this year, currently, and it will be continued, obviously, through Friday and Saturday, what we're seeing is it's pretty unclear whether a handful of high-income countries protecting their industry interests will actually endorse the updated Appendix 3, which is our priority cost-effective interventions for NCDs, which are evidence-based, and we know they work in terms of reducing the burden. So it's for all these reasons that as NCDA, we focus on advocacy to governments on implementing evidence-based population-wide policies to address NCD risk factors, including regulation and fiscal measures. And it's for this reason that we insist that industry must not sit around the policy-making table and that the unhealthy commodity industries cannot be treated as equal partners when we're talking about the Sustainable Development Goals. Thank you.
Great. So we would have some questions to Kate, and if there are no questions from the floor at this stage, I want to ask you a question about the role of civil society in inside countries. There's absolutely no doubt that the NCD Alliance is having a prominent role at the global level. But when it comes to what is actually happening inside countries, very often, particularly in developing countries, including some high-income developing countries, there is no strong movement, civil society movement. It's very weak, and it is not playing a significant role in what you are actually presenting as a role for the NCD Alliance. So what is the role of the Alliance in placing maybe a much higher priority on activating and making sure that the civil society at the country level become much more active and much more engaged in addressing the commercial determinants for health?
It's a good question. So I think, obviously at the national level, this is where it all happens. I mean, obviously what we do at the global level is really important, but we need to have strong civil society organisations and alliances at the national level. And as I said, I mean, I think we have seen great progress in the civil society movement in NCDs coming together. I mean, if you look a decade ago, the diabetes crew were out there, the cancer organisations were over there, the heart crew were over here, tobacco control over there. I mean, there wasn't a huge amount of unity and talking as one. And I think, over the past 7 or 8 years, that has changed. But I agree that the capacity of civil society organisations, particularly in low and middle income countries, still isn't what it should be. What we as NCDA are doing is focusing firstly on capacity development. And when we talk about capacity development, we mean strengthening the capacity of civil society organisations, particularly in their role as advocates. And so building the demand for healthy environments. Playing an accountability role. This is a growing area for civil society in terms of tracking government progress. But equally, in terms of our role in accountability, we also need to be being a watchdog to the private sector as well. It's not just about what governments are doing. So NCDA is now increasingly providing kind of services, tools, seed grants to alliances and organisations to strengthen their capacity to make sure that they are front and centre of the NCD response and working with governments. The other way that we're doing it is actually just by trying to broaden the space and engagement of civil society with governments, because I think quite often, both at the global level and at the national and regional level, sometimes governments pay civil society a little bit of lip service. We get invited to meetings, but it's not really, it's more kind of in the early stages of policy discussions. And so I think what we try to do as well is really try and emphasise the important role that civil society has with governments, and make sure that they see them as a partner, both from an advocacy perspective, an awareness perspective, but also from an implementation perspective, because so many times it's actually civil society organisations that are delivering services in low-income countries as well.
Thank you, Kate. So Francisco Branca, and then I think we will have to close.
Francisco Branca, thank you, Katie. In this particular space, we know that without civil society in Mexico, we wouldn't have taxation on sugar sweetened beverages, so there's a clear role there. If you have to list the top asks that civil society would make to the government, what would you say?
Within nutrition?
In nutrition, yes.
In nutrition. In terms of the top asks, I think the first one would be, taxation. We're seeing it work. We're seeing it work in Mexico, and so I think fiscal measures within nutrition. We're seeing time and time again across the alliances, as I say, that fiscal measures is top of the list. I think the other aspect is obviously improvements in around marketing to children. Because we're seeing, real challenges within that. Another kind of aspect of what civil society, I think, would call for is, it sounds like an obvious one, but it's not always easy, is political leadership on the issue, and actually being able to work across government on issues of nutrition and NCDs, which, again, having worked in a government, I know it's not an easy feat. I think those are some of the three things that we would call for.
Okay, then the last one.
Sorry, me again. And Katie, thanks. I really enjoyed your talk, and because we've had our differences in the past, and I have my differences with everybody, don't I? But the point is that NCD Alliance has changed, and it has brought on some of the very things that were the cause of our differences. And NCD Alliance in the beginning was not as clear as you are now about where industry should be in the policy setting. That's why we started the Conflict of Interest Coalition, which has 161 endorsers and everything. But that whole point of that was to keep policy setting free. Now, what the small question I want to ask you is, and half of the reason was also about corporate funding of NGOs. And I've been in this business a long, long time, and I've just seen more and more NGOs take corporate funding. And I've seen them quieten down, and I've seen them look the other way and do things with industry to make them more on corporate social responsibility and just not address legislation. So that's the message I want. I think without the truly independent, non-corporate funded NGOs, I don't think this will happen because everyone's too frightened. And I have no idea where NCD Alliance is now. I'm totally confused because everything you said, I thought, oh, that's okay. So that's good, and thank you very much. Okay.
Sure. I think message delivered. Yeah. Okay, so it's been really a very interesting dialogue, and I feel we could continue, and I was very much hoping that we could get some more input from the audience, but time is over. Actually, this is the last minute, and we were determined to finish on time, so I'll just make maybe some final comments. I feel that the outcome of this discussion will provide some important input to a number of events that will take place focusing on this issue over the coming even weeks and months. This is, as I mentioned before, one area that needs some in-depth analysis and discussion if we really want to accelerate the progress that countries and also the international community is making in NCDs. And it's absolutely clear from this discussion that more work is needed, a higher level of engagement with different sectors of government, and this is a responsibility not only of the civil society and or organizations like WHO, but also this is the responsibility of the health sector in each country. I think also it's clear from the discussion that we need to achieve a more serious system of accountability and monitoring implementation, particularly in terms of the roles of the various players, the responsibility of different actors, both within government, but also in the private sector. We did not have time to talk about urbanization and the impact of globalization, because globalization is increasingly promoting the negative aspects of the commercial determinants of health. Trade agreements are sometimes restricting governments from taking concrete action or even from introducing policies that aim to reduce risk factors. And there is always the threat of lawsuits under trade and investment agreements. And this definitely encourages countries from moving forward and taking some active steps to reduce risk factors. We talked about the evidence and Ilona started showing some slides on the evidence on the magnitude of the issue. But there is less evidence and less data available on so many aspects related to the commercial determinants of health, the economic aspects, the aspects related to intelligence on certain practices, the sophisticated marketing strategies and approaches that are used to influence consumer behaviors and also people's choices. That is an area, when you look at this area, you see a huge gap in our knowledge. And if you really want to address anything, then you need to start with some sort of a situation analysis, and you have to have some concrete, reliable data on what you are dealing with, and particularly in some complex issues as the one that we are discussing today. I mean, I've always been frustrated with how countries are not managing to implement the recommendations on marketing of food and non-alcoholic beverages to children. This was a set of recommendations that was endorsed by the World Health Assembly. I was the ADG responsible for this, and we were full of hope that we would really move forward. Now, after so many years, and this was, well, dates back to, I think, 2009? 10. Now, 7 years later, when you look at what is actually happening in the country, it's very frustrating, the kind of progress that we are making. So I think at the end of this event, we are left with a number of very important questions that we need to direct to the different stakeholders. They should clearly do more, and they should really revisit their mandate, the stakeholders represented here and the stakeholders who are not represented in this. I think, based on this discussion, and I want to go back to the question I directed to Ruko, we need to know how we can motivate the corporate sector to be a true partner and a positive stakeholder in promoting health and combating the NCD epidemic. If we manage to do this, I think we will make a very significant progress. And I think for the private sector firms that are making some positive initiatives, how can we motivate them to invest more? And for those who are not doing anything, who are struggling or hesitating to consider a change of strategies, how can they move forward? I take your point about the importance of engagement of the broader private sector entities within each country. And so it is not just the big multinationals, but if you really want to move forward in implementing interventions, then the domestic manufacturers and the economic operators at the country level have to have a key role. And one other point that we did not discuss, and I was hoping that it comes from the audience, is on trade agreements. I was very much involved in the negotiations of member states in New York, just prior to the September 2011 high-level meeting. And one of the issues that countries were stuck with, and I think Werner is still here. Werner is here. He has left. He was also one of the coordinators of this. Was the differences that different countries have on trade agreements, because trade negotiations can definitely include exceptions to regulate in trade and investment agreements. For example, the Trans-Pacific Partnership includes exemption and specific statements on the right to regulate. And we know that the TRIPS flexibility does that too, and the SPS. But the key issue I want to highlight is that the health sector is not playing a role in trade negotiations. And public health professionals rarely participate in these kinds of discussions. They're not active partners in negotiating trade agreements or even resolution of trade disputes. And I think this has to be addressed, both for the public health community to be engaged effectively. They need to have, of course, clear understanding of the health effects of these agreements. So this has been, as I said, a very, very positive dialogue, and I'm sure it will have a positive impact on the next steps in addressing this important issue. I want first to thank our colleagues here in the Global Health Center who have been organizing this. I'm looking at Sarah now. Thank you very much, Sarah. And I don't see Michaela Tolt here. Yes, thank you so much. So she was the driving force behind this, and I hope we will continue to work with you in this area of work. And I want also to just mention, I've been asked actually to mention this to all of you. There is another event that will take place here, I think in this meeting room, Michaela, on the 6th of June. On the 6th of June, President of Uruguay, President Tabara Vasquez, is going to visit Geneva. And during his visit to Geneva on the 6th of June, he's coming here. And he will make a presentation which is more or less related to what we are discussing today on the multi-sectoral coordination on non-communicable diseases, the experience of Uruguay. And you know that the experience of Uruguay is very much interesting to all of us. The case of the tobacco control in Uruguay will be the focus of the presentation and maybe even some discussion. So it will take place here, June 6th, 10:30 a.m. to 11:30. So you are all welcome to participate. And finally, I would like to express my great appreciation to the panelists. We had great input from you. So thank you very much, Honorable Minister, Mr. Rinaldi, and Katie. And thank you all for your active participation.